Hi, my name is Chloe, and this is my administer oxygen video. I'm in course BSN 206, section 13. So for this video today, our supplies are going to be a nasal cannula, the non-breather mask, and the 4x4 gauze. And then also this guy right here. So for this video, we're going to go ahead and start off by doing the nasal cannula first, and then I'll go ahead and switch on to the non-breather mask and perform it that way. So the first thing that I would do is I'd go ahead and knock on the patient's door, go ahead and walk in, close the curtain for privacy, go ahead and wash my hands, introduce myself. Hi, my name is Chloe. I'm going to be your nurse today. Can you please verify your name and date of birth? Perfect. So today we're going to be administering some oxygen through a nasal cannula as prescribed by the doctor. So the first step would be opening up the package. I'm going to go ahead and... So we'd go ahead and open up the package. And in this video, I don't have the extension, so I'm just going to go ahead and verbalize everything. So what we would do once we open up the package is on this end, we would go ahead and attach the extension, and then from then we would attach the extension to the source of oxygen as well as the flow meter. So once we go ahead and do that, I would be good to turn on the oxygen to the prescribed rate from the doctor. And for nasal cannula, that ranges from 2 to 6 liters. In this case, I'm just gonna put it on to 3 liters, and once it's turned on, then I can go ahead and turn to the patient and put it on to him. So when putting on the nasal cannula, you wanna make sure that these prongs are both into the patient's nose, and then you're gonna wrap it around the ears. Making sure it's in the nose is really important just because you wanna make sure that the patient is getting the oxygen needed. And then down here, if you push this up, it goes ahead and tightens it. You don't wanna make it too tight, but you also don't want it too loose to where it could fall off. And then once it's on, we can ask the patient if he feels comfortable. And then this is where the 4x4 gauze would come in. So in some cases, we would go ahead and put 4x4 gauze in between the tubing and the patient's skin to prevent any skin breakdown, any pressure injuries. And so how we would do that is we would just put it in just like this. And we mostly see this on the cheekbone or behind the ears, where the tubing is more prone to rubbing against the skin. So once we do that, it's important to check on the patient every 2 hours. Make sure the oxygen is good, it's full, and then also checking on the gauze as well. So once we're done with that, to remove it, you would go ahead and loosen it. And then we would go ahead and go like this and just like that. Once I'm done with this, we would then dispose of it. Then I would make sure the patient is comfortable. If he is, I would go ahead and perform hand hygiene and then go ahead and document my care. So that completes the nasal cannula part. Now I'm gonna go ahead and move on to the non-breather mask. So again, I would go ahead and knock on the door, go ahead and close the curtain for privacy, perform hand hygiene, introduce myself. Hi, my name is Chloe. I'm gonna be your nurse today, and can you please provide me your name and date of birth for verification? Once they do that, I would then explain the procedure that we're gonna go ahead and administer the non-breather mask for oxygen prescribed by the doctor. Once we're done explaining the procedure, I would then open up the package. There's our mask and then our tubing. So again, in this video, I don't have the extension, so I'm just gonna go ahead and verbalize. So with this one, we're gonna go ahead and open this up. Just like this, because we wanna make sure that the oxygen can get through and inflate it. Once we do that, we're gonna go ahead and attach the tubing to this probe right here. And then on the other end is where we would attach the extension. Once we attach the extension, we would go ahead and attach the extension to the source of oxygen as well as the flow meter. Once we do that, we can turn on the prescribed amount of oxygen that was given by the doctor. For these masks, it's gonna be 15 liters because you want to make sure that there's enough oxygen to inflate this so that the patient is actually getting enough oxygen. So once we go ahead and plug all that in, we can now put it onto the patient. You want to put this part behind the head like that. And as you can see, it's really loose. So what you can do is on these right here, you can pull them tight to become more secure, so that it actually fits the patient. And if you go ahead and squeeze on the nose, it will fit the size of their nose as well to just hold it in place. But again, you don't want to do it too tight, but not too loose to where it's falling down. So just the perfect amount, and you can kind of mess around with that to see what's best for each patient. So once you do that and it's on and everything's going good, then we can get the 4x4 gauze. And again, we can use this to help prevent any skin breakdown, any irritation that may come up from the patient wearing the mask, as well as these bands right here. So what we could do is we could put it up here by the nose. We can go behind the ears or on the cheekbone right here to where it's going up to behind the head. Once we're done with that and the patient is all good to go, we would make sure that they're comfortable and being sure to check on them every 2 hours. So now to remove this, we would want to loosen it a little bit just so that we're not pulling on the patient's skin at all. And you want to go ahead and pull from behind and over, just like that. So once we're done with this, we would then go ahead and dispose of everything. Now that we've done that, I would then make sure the patient is comfortable. If he needed anything, make sure the call light is in reach, bed is low. Any personal belongings are in reach as well. Once I'm done with that, I would then perform hand hygiene and document my care. And that completes my oxygen administration video. Thank you.